It's really nice that for the organizer to put my talk after Professor Storella's fantastic global health review. My name is Ziming Xuan. I'm a professor from the Department of Community Health Sciences in the School of Public Health. And I was zone in and talk about a specific public health problem in China, and that's alcohol consumption. And just want to get down to the bottom that alcohol is not an ordinary commodity. It's commodity. It's a commodity, which in itself is subject to the laws of supply and demand, but it's also not an ordinary commodity because it imposes substantial public health burden in any society. So if you look at the per capita consumption of alcohol in China, over the last 15 years, there were a twofold increase of alcohol per capita consumption in China. About 23% experience excessive binge drinking, about 5% experience alcohol-induced mental disorders, including suicidalities, which is very severe. And a much greater proportion of male drink a lot, about 8% experience alcohol use disorders. And alcohol consumption not only affect those who drink, but also affect those who do not drink. So there are a lot of harms experienced by others for those people who are not even drinking, for example, drinking behind the wheel, drinking under influence. And there are a lot of cars in China, as we learned from Professor Yaming's talk. So what would contribute to the rise of alcohol in China? Looking at this chart of over 40 years of data collection, how China is compared to other countries, we can see from the dotted line for China, the country in itself has really culturally ingrained alcohol consumption. There's no banquet without drinking. And thanks for the host of Office of Research. I think we have some wine afterwards. So drinking is widely acceptable and also is increasingly affordable because of the rising social and economic development. But also, because of rapid urbanization, it's very easy to find alcohol in almost every part in China. And certainly this will not escape the factor, those who are making alcohol available, the globalization and marketing and sponsorship, making alcohol ever appealing. And just want to show you some current alcohol marketing activities. This is a very famous Hong Kongese singers promoting Anheuser-Busch on responsible drinking, so to speak. And then we have the newer social media, and here is the influencer really depicting the act of drinking, not by little, but a lot. And by any standard, this is highly excessive alcohol consumption. And social media obviously are very common and popular among youth. And this is a segment that the industry is targeting. So what contributes? Well, the government actually ended the monopolization of alcohol production in a way to adhere to the WHO, the World Trade Organization, and they lower alcohol taxation by a lot to adhere to that standard. And in terms of regulating alcohol, there is no or very limited regulation on the days of sales, the hours of sales, and whether or not alcohol can be consumed in public places. There's a law prohibit minors to drink, but as I grow up, people can easily buy alcohol regardless of how old you are. I want to pay some tribute to the late Professor Geoffrey Rose's seminal work in Prevention Paradox. The idea is, if we just focus on those who drink a lot, the impact on alcohol policy is very limited. We should broaden the scope so that we can have the alcohol policy and effective ones to reduce the population risk of excessive consumption to the latter degree. And the WHO has advocated certain policies, including making alcohol more expensive, limiting availability, and restricting alcohol advertisements. And we also want to see alcohol enforcement at all levels. Thank you very much.